Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Vaginal cancer. Introduction. The vagina is the muscular canal that goes from the uterus to the outside of the body. Cancer that starts in the vagina is called vaginal cancer. This type of cancer is rare. The earlier vaginal cancer is found and treated, the more likely are the chances of a successful treatment. This type of cancer can often be cured in its early stages. This program will help you better understand vaginal cancer. It also talks about what treatment options are available. Female reproductive system. The vagina is part of a woman's reproductive system. The reproductive system is made up of organs involved in producing children. This section reviews the structure and functions of these organs. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. When an ovary releases an egg, the egg goes down the fallopian tube to the uterus. It may become fertilized along the way. If a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to expand a lot. The inner layer of the uterus is called the endometrium. This lining grows and thickens each month to prepare for pregnancy. If a woman does not become pregnant, the endometrium flows out of the body. This is called a menstrual period. As menopause approaches, periods become irregular. Eventually, they will stop. Menopause happens when the ovaries stop making hormones and releasing eggs. The narrow lower part of the uterus is the cervix. The cervix is the passageway to the vagina. The vagina opens to the outside of the body between the urethra and the rectum. The vulva is the external female sex organs. It includes the vaginal lips, clitoris, openings to the vagina and urethra. Vaginal cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. It is also called a non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For example, a vaginal tumor may grow through the outer layer of the vaginal wall. It can then spread to nearby tissues over time. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the vagina will always be called vaginal cancer, even if it spreads to other places. There are two main types of vaginal cancer. 1. Squamous cell carcinoma. This cancer begins in the thin, flat cells lining the vagina. It spreads slowly and is the most common type of vaginal cancer. 2. Adenocarcinoma. This cancer begins in the glands lining the vagina. It affects cells that make and release fluids such as mucus. It is more likely to spread.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risk factors. It is usually impossible to specify the cause of cancer in an individual, but we do know what causes cancer in general. Healthcare providers also know factors that can increase the chances of getting cancer. These are known as risk factors. Age is one risk factor for vaginal cancer. Vaginal cancer is more common in women 60 and older. The earlier a woman begins sexual activity and the more sexual partners a woman has, the higher the risk of developing vaginal cancer. Women who smoke, have HIV or AIDS, or have an HPV infection are also at a higher risk. If your mother took DES when she was pregnant with you, your risk goes up. Certain changes in the female reproductive organs increase the risk of vaginal cancer. These include a history of abnormal cells in the cervix or uterus, a history of cervical or uterine cancer, a hysterectomy. Not everyone who has risk factors for vaginal cancer develops vaginal cancer. People who have no risk factors for vaginal cancer can still get it. Symptoms. Vaginal cancer often does not cause early symptoms. It may be found during a routine pelvic exam and Pap test. A Pap test collects a sample of cells from the cervix and vagina to be tested for any abnormalities. It can show early cell changes that may become cancer. When symptoms do appear, common symptoms of vaginal cancer may include a lump in the vagina, bleeding or discharge not related to menstrual periods, pain in the pelvic area. Symptoms of vaginal cancer can also include constipation, pain during sex, pain when urinating. These symptoms may not be caused by vaginal cancer. Make sure to see a healthcare provider to find out what is causing your symptoms. Diagnosis. The best way to treat vaginal cancer is by finding it very early. It is sometimes possible to find this type of cancer even before it causes any symptoms. If you have symptoms of vaginal cancer, your healthcare provider will try to find out if vaginal cancer is the cause of your symptoms. There may be other causes. Your healthcare provider will ask you about your family medical history in addition to your own. He or she will perform a physical exam. The physical exam will include a pelvic exam. A pelvic exam checks for lumps or changes in the vagina. It also checks the uterus, cervix, fallopian tubes, ovaries, and rectum for any changes. A Pap test can also be done during a pelvic exam. A Pap test collects a sample of cells from the cervix and vagina to be tested for any abnormalities. It can show early cell changes that may become cancer. A test called a colposcopy may also be done to diagnose vaginal cancer. A colposcopy uses a lighted, magnifying instrument to examine the vagina and cervix. This makes the tissue easier to see. During a colposcopy, tissue samples may be taken using a spoon-shaped instrument called a curette. The removal of cells or tissues from the vagina and cervix for testing is called a biopsy. A biopsy is the only sure way to know if cancer cells are present. Staging. If you have vaginal cancer, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body. Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. Staging is helpful in deciding the best course of treatment. When staging vaginal cancer, healthcare providers want to find out whether the tumor has invaded tissues outside the vagina, whether the tumor has spread, and if so, to what parts of the body. If vaginal cancer has spread to nearby lymph nodes, it can spread to other areas of the body. Vaginal cancer most often spreads to nearby tissues in the pelvis, the bladder, and the rectum. It may also spread to the lungs or bones. Imaging tests may be done to see if vaginal cancer has spread to other parts of the body. These tests may include a chest X-ray, CT scan, or MRI. A PET scan is another imaging test that can show if vaginal cancer has spread elsewhere in the body. For this test, you are injected with a small and safe amount of radioactive sugar. The PET scanner makes a picture of the places in your body where the sugar is being taken up. Cancer cells show up brighter because they use sugar faster than normal cells. Other tests that may be done use thin, long tubes called scopes to look inside specific areas of the body. Some examples are cystoscopy, which looks inside the bladder and urethra; ureteroscopy, which looks inside the ureters; proctoscopy, which looks inside the rectum. Biopsies may also be done during these tests. A biopsy of the cervix or vulva can also be used to stage vaginal cancer. The tissue samples can show if the cancer has spread to these areas. Treatment and supportive care. The type of treatment used depends on the size and location of the tumor, stage of the disease, general health of the patient. Treatment for vaginal cancer may involve surgery, radiation therapy, or chemotherapy. Some combination of these treatments may be used. Surgery for vaginal cancer depends on where the cancer is located and how far it is spread. The surgeon may remove just the tumor or all or part of the vagina. The uterus, cervix, ovaries, and fallopian tubes may also be removed. Radiation therapy uses high-energy rays to kill cancer cells. It also stops cancer cells from growing and spreading. External radiation comes from a machine that aims the rays at a specific area of the body. Internal radiation uses a radioactive substance sealed in needles, seeds, wires, or catheters. These objects are placed directly in or near the cancer. The way radiation therapy is given depends on the type and stage of cancer being treated. Chemotherapy is the use of drugs to kill cancer cells. Chemotherapy may be given in the bloodstream through an IV or taken by mouth to treat vaginal cancer. Chemotherapy and radiation therapy may be done together to treat vaginal cancer, but these treatments may also be used on their own before surgery or after surgery. There may be clinical trials available for people with vaginal cancer. Clinical trials test new medical approaches and treatments. Vaginal cancer and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms, relieve the side effects of therapy, help you cope with the emotions. Supportive care also deals with the pain associated with cancer and its treatments. Your healthcare provider or a pain control specialist can suggest ways to relieve or reduce pain.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The vagina is the muscular canal that goes from the uterus to the outside of the body. Cancer that starts in the vagina is called vaginal cancer. This type of cancer is rare. If you have vaginal cancer, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body. The earlier vaginal cancer is detected and treated, the more likely are the chances of a successful treatment. Vaginal cancer can often be cured in its early stages. Treatment options for vaginal cancer usually include surgery, radiation therapy, or chemotherapy. Some combination of these three may also be used. Research already has led to advances that have helped people live longer. It continues to find better ways to care for people with vaginal cancer. Thank you for using Explain.